Hello, and welcome to St. Jude and Five-ish. The Center to Advance Palliative Care reported that more than 180 million Americans will suffer from some form of serious illness over the next 25 years. All of us have known someone who has experienced a serious illness and understand the devastation that can be caused. We are very fortunate to welcome Gloria Franklin, Manager of Palliative Care for St. Jude Medical Center, to discuss this growing trend and how it impacts healthcare, in particular hospitals and our most seriously ill patient populations. Thank you so much for joining me today, Gloria.
Thank you for having me. I'm happy to be here.
Let's start with some of the basics. What exactly is palliative care?
So palliative care is specialized medical care for patients with serious illness. We provide an extra layer of support to patients and their families and work on things like symptom management for pain and also the stress of chronic illness. And we can be called in any time of a diagnosis, from the very beginning all the way to the end. Many of our patients sometimes have chronic disease that lasts for a long time, like COPD or congestive heart failure, while others we see maybe with advanced cancer that are a little more progressed in their disease. So it really does range quite a bit.
And so a lot of times I feel there's this confusion between palliative care and hospice. Can you explain to me the difference?
Sure. It's one of the most common questions that we get asked. Palliative care really, again, covers the whole length of an illness. We can be called in right when someone's diagnosed, say with COPD, and there's not having very many symptoms. So at that point, we don't do very much. But as their disease progresses, we might work on their symptoms a little bit more, work on advanced care planning, getting an advanced directive in place. And then at the end of that illness, that's where hospice kind of takes over. And they focus on just that comfort care. We're no longer looking for a cure, and we're really just focusing on comfort in that end of life phase.
Taking care of those patients.
Yeah.
Now, what are some of the challenges that patients with a serious illness face?
So one of the biggest challenges that we face with our patients is really understanding what their disease process looks like, what's wrong with them, and what their prognosis is. So how bad is their disease? We spend a lot of time with our patients really educating them, understanding where they're at. We call it health literacy. And I think understanding what their prognosis is really helps them understand what's important to them. In that same regard, navigating the healthcare system is a big challenge. Knowing where to go, what doctors to see, what they're supposed to do next, what treatment should they do, should they not do. It can be very confusing to someone that doesn't really know the healthcare system very well.
And so you really provide that guidance and support at every step of that of the way.
We really meet patients where they are. We don't make decisions for them. We don't push our feelings onto a patient. We just try to support them through that disease process.
And can you tell me a little bit about what makes the St. Jude Palliative Care Program special?
Sure. The first thing is we're interdisciplinary. We have nurse practitioners, physicians, nurses, social worker, and a chaplain that work in our team. And that really helps us to provide whole person care for these patients. Secondly, really unique to St. Jude, we're able to see really a lot of patients. We see about 20% of our hospital admissions, which is really great.
And why is that? Does that go back to that interdisciplinary component, or?
Well, at St. Jude, one of the unique things is that anybody can put in a palliative care consult. It doesn't have to be a physician, though we do communicate with our doctors all the time. But a social worker can put in a consult, a case manager, a speech therapist, a physical therapist, and having that kind of open dialogue with all of our different interdisciplinary staff members really helps us identify patients that we might have missed otherwise.
And so how do patients and their loved ones access palliative care if they think they are wanting to choose that?
Of course. So, of course, they can talk to any member of their healthcare team if they're in the hospital, because anyone can put in a consult for us. But we also have outpatient services. We have a clinic in the outpatient setting that can see patients. And all you need for that is just a physician referral, so you can talk to your primary care doctor about that.
Okay. Well, let's transition a little bit and get to know you a little bit more personally. So I understand that you are a nurse practitioner. Can you tell me a little bit about what it was that made you want to pursue that as a career?
Sure. So I've been a nurse practitioner since 2005. I was an ER nurse in the beginning, and I really just wanted to be able to have a bigger impact on patient care. I wanted to be able to plan care for my patients and really provide the best possible education for them. And I feel that being a nurse practitioner does provide that best of both worlds, being still a nurse, but also being able to really understand the medicine part of the care that we provide.
Mm-hmm. And I also heard that you recently went to Cotillion. Can you tell me a little bit about that experience?
So I didn't really go to Cotillion. I watched Cotillion. My daughter participates in Cotillion. She's 9 years old, and that's where they teach them manners and they dance and wear little white gloves. And I love it because my daughter is very much a mix of athletic. She's played softball, and she does great with that. And then also being a kind of a girly girl and doing cotillion and wearing fancy dresses. And I really love the fact that she's fearless. And one night she'll be sliding into home and getting all dirty, and the next night she'll put on her white gloves and dance with boys and learn proper table manners.
It's really the best of both worlds.
Yeah.
Well, thank you so much for joining me today and sharing your time. And thank you for all of you for tuning in.